Hi there, Eric Bakker, naturopath, author of Candida Crusher, with a further frequently asked question. How does the doctor test me for a yeast infection? Well, there are many ways that your doctor could potentially test, but if you're talking about a vaginal yeast infection, your doctor will probably do a smear test and take some cell samples there of the cervix or the vaginal wall and check them out for see if they can culture yeast off this or bacteria. The other way that some doctors do it is by way of blood testing, by checking for antibody levels. But generally medical practitioners will test by doing swabs. Not many medical practitioners really believe in systemic candidiasis or blood-borne candida infections, even though they do exist, and there's certainly plenty written in the medical literature about this. Not many believe it. But antibody testing is quite valid, although some argue that you can have antibodies all your life to Candida and not have symptoms, what we call asymptomatic. Others believe that antibody levels are significant regardless whether you have symptoms or not, and still signify that you need treatment for Candida. I believe the best way to test for a yeast infection is a stool test, and I'm going to do a lot of FAQs on stool testing and explain stool testing in depth to you. The various components of the stool test and why this is a superior way to test for yeast infection. So how does a doctor test for a yeast infection? Usually a swab or a vaginal test is the main way, if they test at all. But yeah, that would be the way they would test. So I hope that answers your question. Thank you.